Allie. I'm going to be doing a physical exam on you today. Is that okay?
Mm-hmm.
Okay. So first we're going to start off with a set of vitals. So that's just going to measure your heart rate and your oxygen, and then we'll take your blood pressure over on this side. So heart rate 72, oxygen 96% on room air. Just now have you rest your hand on my arm. (122/82). Respiratory rate 12. I'm going to get your temperature real quick. Okay, 97.4. Taking a look at Pearson, he appears to be of good health and hygiene. Posture is appropriate. During ambulation into the room, gait was smooth. No obvious signs of distress. His muscles are symmetrical bilaterally. His face is symmetrical. There seems to be no obvious masses or lesions present. No masses again to the ears or the face. Nose is symmetrical. Lips are pink and moist. Eyes are without ptosis. Ectropion or entropion. And Pearson, head is normal cephalic and atraumatic. Scalp is slightly dry. Skin is thin and well distributed. Pearson, any pain with palpation to your head?
No.
Okay, this next part, I'm just going to take a look in your ear. So if you could tilt your head slightly that way. Mucosa is pink, or ear canal is patent. Tympanic membrane is a pearly gray in color. Bilaterally. Pearson, we're going to do a little bit of a test on your hearing. So this first part is I'm going to use my tuning fork. I'm going to make it ring and put it on the center of your head. You're going to tell me if you hear it in both ears, okay? Or which ear you hear it in.
Both ears.
Okay, then this next part I'm going to put it in the bone behind your ear. You're going to tell me when you stop hearing it.
No.
And do you hear it again?
Yes.
Okay, we're going to do that again on the other side.
No.
Did you hear it?
Yes.
Okay, so hearing intact bilaterally. In this next part, I'm going to take a little bit of a closer look at your eyes. So if you can pick a spot on the back wall and stare at it. And I'm just going to shine it generally on you. Okay. And then again, bright light coming at you. So pupils equal and reactive. And Pearson, I know you love that light, so you'll really enjoy this one. Light as dim as possible. So if you can take a look. Okay. So optic disc and cone visualize, no evidence of papilledema or AV nicking. Pearson, if you can look up towards the ceiling for me. Conjunctiva are pink. And while you're sitting here, Pearson, I'm going to take a little bit of a closer look inside your nose. Okay, so if you can tilt your head slightly back for me. upper and lower protuberances visualized. Mucosa as pink. A slight amount of clear drainage noted bilaterally. Slight septal deviation to the right. In this next part, Pearson, I'm going to take a closer look inside your mouth. And I did see that you chew tobacco, is that correct?
Yes.
So I do want to let you know that tobacco puts you at risk for oral cancer, esophageal cancer, pancreatic cancer, as well as a lot of other dental problems. So I would advise that you quit it, okay? If you can open your mouth up for me. Teeth appear. Say ah for me. Okay. Mucosa is pink. No evidence of erythema to the pharynx or the tonsils. Excuse you. Is that a sneeze or a?
Yep.
Yeah. And if you can stick your tongue out for me, you're gonna feel down the sides. No masses or nodules felt on the tongue. No masses or nodules felt in the buccal space. Teeth are well seated. No obvious cavities. Pearson, right here, I'm going to take a feel of your throat. So trachea is midline. Going off cartilage, if you can swallow. Okay, so thyroid is without bogginess or nodules. And I'm going to feel your lymph nodes real quick. Let me know if any of this hurts. Preauricular non-palpable. Postauricular non-palpable. Tonsillar. One small node on the right side. Submandibular. Non-palpable. Submental. Non-palpable. Posterior cervical. Non-palpable. Superior cervical. Non-palpable. If you could turn your head slightly to the side. Deep cervical. Non-palpable. Bilaterally. And if you can lift your arms up for me, or your shoulders up. And supraclavicular non-palpable. I'm going to push down in your shoulders if you can push up. Okay, and relax. I'm going to push on the side of your head. Don't let me. Okay, and resist. And I'm going to push backwards. Resist. Perfect. Go through my checklist in my head. While you're here, I'm going to feel your pulses on your upper extremities. So, brachial 2+. Move your watch. Radial 2+. And put your feet down. Popliteal. Posterior tibialis. 2+. And dorsal 2+. Next, I'm going to have you go through a range of arm movements for me. You can put your hands out to the side, and put your hands up towards the head, and down towards this. Okay, and down by your side, and if you can put them straight out, and straight back. Perfect. Okay, so I'm going to do that now for you. I want you to tell me if you have any pain with any of this. Any pain?
No.
Any pain in your wrist? How about in any of your fingers?
No.
No. Hands are without cyanosis, clubbing, or edema. Skin is warm to the touch bilaterally. Skin turgor is within normal limits. Cap refill is less than 2 seconds, and we'll do that again on the other side. Any pain with that?
Nope.
How about with your elbow?
Nope.
And with your wrist?
Nope.
And any of your fingers?
Nope.
Okay. Real quick, I'm going to check here. Cap refill is less than 2 in bilateral lower extremities. No pretibial edema. No evidence of cyanosis, clubbing. I think that's it. And Pearson, if you can turn with your back towards the camera, so if you can turn around the other way. And do you mind if I undo your robe?
Nope.
Okay. So looking quickly at Pearson's back, there are multiple nevi noted ranging from a brown to pink in color, and a couple small scars. And Pearson, you said you had some moles removed?
Yes.
Okay. So next part, I'm going to be tapping on your back. Tell me if you've got any pain with this, okay?
Mm-hmm.
Okay, so resonant sound heard during percussion in all lung fields. And if you can say the words 99 when you feel my hands.
99, 99, 99, 99.
Perfect. And I'm going to take a listen to your lungs real quick. So when you feel my stethoscope, if you can take a deep breath. Oops. And two more. Last one. Okay. And while I have your back out, I'm just going to feel down the back of your spine. Let me know if you've got any pain with this, okay? So cervical, or at the C7T1, moving down the paraspinal muscles. And we're at lumbar. Any pain with any of that?
No.
Slight hypertonicity noted in the thoracic and lumbar regions. No pain on palpation. Vertebral column seems to be midline without any deviations or evidence of scoliosis. So Pearson, for this next part, I'm going to have you move over to the exam table. Here. Prep it. So if I can have you take your arms out of here. Okay. And first I'm just going to take a look at your chest, and then I'll do some measurements and listening and feeling, okay? Looking at the precordium, no evidence of lifts, thrills, or heaves. Feeling for the PMI. At the fifth intercostal space, at the midclavicular line, it is not visible. No jugular vein distension bilaterally. And I'm just going to take a look at your DVP. It's right there. And finding the angle Louise, our sternal match. So JVP is approximately 2 centimeters above the sternal match. Okay, and we're going to do the same thing where I tap on your chest, okay? Okay, so resonant sound heard and on all lung fields percussed. And if you can say the words 99 when you feel my hands.
99, 99, 99, 99.
Perfect. I'm just going to take a listen to your lungs while I'm right here. Take a deep breath in. Okay. And just a couple more. And last one. So looking briefly, or looking quickly at the abdomen, so there's no vein distension, umbilicus is midline. There's a couple of nevi noted, ranging from a pink to brown color again. And Pearson, I'm going to listen to your heart while I've got you right here. Realized I didn't talk about your... S1 and S2 clearly heard, no evidence of splitting. S3 or S4 or murmurs, gallops, or friction rubs. And I'm going to listen to your stomach real quick before I feel anything. Bowel sounds active at all quadrants. Listening to aorta, renal, iliac, and if you don't mind, I'm just going to move the top of your undergarments down a little bit. Femoral arteries. And that is confirmed with the bell. So Pearson, I'm just going to feel lightly on your abdomen at first. Any pain with this?
No.
No. Okay, and then doing it a little bit deeper. So I'm feeling into those colons. I'm feeling for any masses. Also feeling for any distended bladder. And Pearson, if you can take a deep breath in and out for me, I'm going to feel your liver. And again, deep breath in and out. And one more time for me. Okay, so liver edge is, liver border is clear, no nodules palpated. And then while you're right here, I'm going to have you take a deep breath in and out. Negative splenic percussion sign. I'm just going to move your hand. One more deep breath in and out for me. Perfect. Okay. So you can go ahead and put this top part back on. And I'm going to move down to your lower extremities. It's going to be a little odd because I'm going to do that before finishing your abdominal exam. So I'm just going to move this. And I apologize for the camera angle. Okay, so just taking a look at your legs. Again, no edema. Excuse me, noted. Pearson, I'm going to take, I'm going to feel your joints. Let me know if you have any pain. Any pain there?
No.
Any pain here?
No.
Okay. Any pain here?
No.
Okay. How about in your toes?
No.
No? Okay. We're going to go through a couple little exercises. If you can point your toes down to the ground and up towards the sky. If you can bring your knees to your chest and put your legs straight back out. If you can do a V and then cross your legs over and do another V and cross your legs over. Perfect. So we're going to do, I'm going to do those similar motions, but I'm going to do them for you. Any pain with that in your hip?
No.
Any pain in your knee?
No.
How about any pain in your ankle?
No.
Or in your toes?
Nope.
Okay, we're going to do it on this side. You can bend your leg for me. Any pain with that?
Nope.
Any pain with that?
Nope.
Any pain with that?
Nope.
How about with your toes?
Nope.
Okay, so we're going to do the same thing, but I'm going to provide force against you. So if you can bring your feet up, or your toes up towards the sky. Okay, and push them back down. Perfect, and bring your knees up to your chest. Okay, I'm gonna push them towards you, don't let me. Gonna pull them, don't let me. Push them out, don't let me. And together, don't let me. Perfect. So, range of motion and strength, 5 out of 5, and on muscles tested. So Pearson, I'm gonna have you sit back up if you can for me. And we're gonna have you switch over to the other side. And I'll put your sheet back on. So if I can have you take your, I can probably do it with just one arm out. I'm just gonna feel this side of your. Okay, deep breath in and out. Spleen non-palpable. And then one more deep breath in and out. And kidney non-palpable. All right. I'm going to move this camera back over here. If you can stand up for me, we're going to do a range of things. So the first thing that we're going to do, would you like me to tie this?
Yeah.
Okay. So the first thing we're going to do is called the Romberg sign. So I'm going to have you stand facing the camera with your feet together and your eyes closed. And if you can just stay straight, we're going to do this for 30 seconds. Perfect. And you can go ahead and put both your arms straight out for me. Negative pronator drift, negative Romberg sign. And this next part, I lost my train of thought. I'm going to look at my sheet real quick. Make sure that I'm not missing anything blatantly. I did your pulses. Can you stick your tongue out and move it side to side? Perfect. If you can sit down for me, we're going to do your reflexes. Next, we're getting something really obvious. Okay. Before I do your reflexes, can you close your eyes for me? Can you tell me if your toe is up or down?
Up.
Okay, and now?
Flat.
And now?
Down.
Perfect. We're going to do that on the other side. Where's your toe?
Flat. Down. Up.
Perfect. And you can open your eyes for me. So this first part, I'm just going to test your reflexes, and you can leave your arm relaxed. Okay. And you're going to put your arm out like this. Okay. And take your watch off.
Mm-hmm.
Okay. Got it?
Got me.
We're going to do that on the other side. Okay, so you can hold your arm like that. Just relax it. And I'm going to lift your leg up. You can go ahead and relax on my arm. Good. I'm going to do that. Perfect. I'm going to hold your leg up again. Just relax your feet. You can relax your leg now. Alright. So reflexes, 2 besides the patellar, which was 3 plus. And then next we're going to do a little memory problem or a little memory fun. So I'm going to give you 3 words if you can remember them for me. So the 3 words are Bear, Susan, and Tough. Can you repeat those back to me?
Bear, Susan, Tough.
Perfect. Okay, so the first thing we're going to do, you know your name.
Pearson, Forbes.
Do you know where we're at?
Home.
Do you know what we're doing?
Physical exam.
Okay, do you know the date?
12/1/20.
Perfect. Who's the president?
President Donald Trump.
Okay. And can you start at 100 and count back by sevens?
100, 93, 86, 79, 72, 65,
That's good. Okay.
58.
You're fine. And can you draw a clock for me? There's a bookkeeper there. Yes, an analog clock, not a digital clock. Perfect. And do you remember the 3 words that I told you?
Bear, Susie, and tough.
Perfect. Okay. Oh, I remembered the one thing I forgot. Okay, if you can close your eyes, I'm going to put 2 things in your hands. Can you open your hands out in your lap? And can you tell me what this one is?
Ink pen.
Okay.
That's what I'm thinking.
And that,
Remember keys.
yep, that is correct.
Sharp as a tack.
And I can't remember if I did this or not, so we're going to do it again anyways. We're going to test your vision real quick. So, can you cover one eye for me? Can you tell me what?
428-739.
And cover the other eye. And read it backwards.
937-824.
Okay, and that is the end of our physical. Oh, I still hear. This is all of it. Can you close your eyes for me? Okay. Can you tell me what you feel? Sharp or dull?
Sharp, sharp, dull. Sharp, dull. Sharp, sharp, dull. Sharp, dull, dull, dull. Sharp. Sharp.
Yep. All right. Well, thank you, Pearson. I'm going to wash my hands.